An effective chest massage can be one of the most underrated ways of treating back, neck, or shoulder pain. So in this video, I'll be demonstrating some of my favorite techniques of targeting the chest to bring some much needed relief. So let's jump right in. The chest is made up of four muscles: the Pectoralis Major, the Pectoralis Minor, Subclavius, and Serratus Anterior. In our daily lives, so many of us do many things that drive our shoulders forward, whether it's driving a car, sitting at a desk all day, or just generally having poor posture. We unknowingly put our spine and shoulder girdle into a compromised position. You see, rounding our shoulders forward shortens the chest muscles, and this means that probably 95% of people are in desperate need of opening up their chest so that they can breathe more freely, move more fully, and live in less pain. The Pectoralis Major is the heavy lifter here of the group, and it has a clavicular head which attaches to the clavicle and a sternocostal head which attaches to the sternum, and then it attaches to the greater tubercle and the humerus. The Pectoralis Minor, which originates on the 3rd through 5th ribs and then inserts onto the coracoid process of the scapula, also is the next, big hitter there. So far I've been demonstrating a lot of pin and stretch techniques, which is using one hand to add a compression or a pin to the muscle belly, and then moving that extremity through range of motion is a really effective technique. And I move my hand along from the sternum attachment to the clavicular attachments to ensure that I'm getting the whole area. And then now just working into the shoulder girdle and the deltoids here, the triceps, the posterior arm, and opening that up with a nice long elongating stretch, contraction out the shoulder, and then some nice range of motion here through the entire shoulder girdle as you come in and out with the shoulder there. Now this more specific technique is where we start to focus in on just pinching the pec major first, really feeling the muscle fibers as it attaches onto the humerus, finding any specific tight areas within that muscle belly, just holding, releasing, pinching. You're really using the fingertips, pulling them towards your thumbs, working the clavicular border there. And then now this technique is to focus in on pec minor, which you're going to go underneath pec major, look for the ribs there, place your fingers right on pec minor, and then move the arm through range of motion. Nice jostling here. So releasing the pecs, the anterior chest, can do such wonderful things when it comes to reducing overall pain, again, for different types of pain patterns and syndromes, specifically related to the shoulder, the neck, or the upper back. So I highly encourage you to find effective ways to open up the chest. And I hope that these techniques are truly useful to you. And as I transition to the other side, this is really a transitional move, just a nice way to enter the area by one hand underneath, one hand on top, just spreading out the chest group along the clavicle there, and then underneath as well. And as I bring the arm out, we're just going to repeat what we did on the other side, a pin and stretch. So it begins with the arm out just laterally, and the elbow stays in place as you roll it in and out there. The hand is really just under the clavicle, holding in place, feeling for tight areas, and moving the arm through range of motion while you pin down the muscle itself. And now as I bring the arm up, the elbow floats off the table. It puts the arm in a different position, which just allows you to get to the muscle fibers differently. Just getting a full, giving you full access to the pectoral group there. And now working that shoulder girdle, deltoid, triceps. And a nice traction and stretch. Tractioning the shoulder by focusing on more of the elbow there as you pull. And then nice scapular movement with this one. And when we open up the chest, we really can give the shoulder girdle more opportunity to freely move properly the way that it should. So there's a different angle of that pincher grip on the pec as you're just holding with your thumbs and then rolling with the fingertips towards the thumb, feeling the belly of the muscle and feeling for any particular areas that need more attention and focus. And then transitioning to more pec minor, which is going to be underneath pec major. Feel for the ribs and continue to move the arm through various range of motions. This just is an effective way to open up the chest. The pin and stretch technique, working your way across that broad pec major into the arm itself. Then you're crossing the multiple tendons that cross the shoulder joint, the biceps, coracoid, all the ones under there that affect shoulder pain and stability. So again, learning to work and open up the chest can be an effective way to treat pain issues and patterns within the neck, shoulder, and upper back. So I highly encourage you to continue to find ways to do this effectively. Thank you for watching today. I hope you enjoyed these techniques. Thank you so much for watching today. If you found that content valuable, please consider subscribing. As always, any questions you have, leave those in the comments down below. Stay healthy, stay strong, and I'll see you next time.